Okay, so respiratory diseases. So one of the first things that I want to remind you of and make sure that you're okay with is the upper respiratory tract goes to the larynx, and then the lower respiratory tract is down deeper into the lungs. Okay, and I think you guys probably have all had anatomy maybe and know about the respiratory system. Okay, so anatomical defenses of the respiratory system. So what's going to protect us from getting things in our lungs? Okay, so we have coarse hairs in our nasal cavity is going to keep things from going in. Mucous membranes, which are sticky and have white blood cells in them that are going to help protect us. We have our tonsils, which are lymphatic tissues surrounding the opening to the respiratory tract. There are normal flora that should be everywhere but the alveoli. Okay, so the alveoli should be sterile. And then the mucociliary escalator is also going to help protect us. So that's the cilia that line the respiratory tract that sweep things up when it gets stuck in the mucous membranes, and then we swallow it. Okay, so there's a bunch of vocabulary words that I feel like you guys can figure out. So there's a bunch of itises. Okay, so itis is inflammation. So we have pharyngitis, laryngitis, epiglottitis, sinusitis, bronchitis, and tonsillitis. Okay, so we're going to start at pharyngitis. So we're going to start with a sore throat. So 70% of the time it's just caused by a virus. 30% of the time it could be caused by bacteria, and one of the bacteria that could cause it is group A strep. So group A strep, if you remember from from lab, is beta hemolytic. The book says it occurs in young people, but I think it occurs in everything. Most of the time it's strep pyogenes, but sometimes it could be other streps. Okay, so transmission, it's through respiratory droplets, so aerosols. Pets can actually be a carrier, and it can be in contaminated food, water, milk. Okay, so the symptoms: inflamed throat, the adenoids and the lymph nodes of the neck swell, the tonsils become tender. These white pus-filled lesions are usually a giveaway. Yes, you definitely have it. Okay, so you get a fever with the chills, headache, body aches. Sometimes people have nausea and vomiting. There's not really cold symptoms, so it's mainly in the throat. Okay, so strep is bad because it does have sequelae that can be pretty bad. So it can cause rheumatic fever, which we kind of talked about. So rheumatic fever is when the heart valves are damaged, and it can cause joint problems too. And it can also cause kidney damage. It can cause glomerular nephritis. So the filter part of the kidneys actually gets destroyed by the antibodies made towards strep. So it's autoimmune disease. There's some evidence that strep infections could also cause chronic fatigue syndrome, which is another autoimmune disease. Okay, so to diagnose strep, they do a throat culture. So they'll put it on a plate, and they'll also do a rapid test, which is an antibody screening test. The rapid is 85% accurate for group A streps, but so they do two swabs so that they can do a culture and a rapid. So it usually responds to antibiotics, to penicillin. If you're allergic to penicillin, they'll use erythromycin. If it's not bacterial, they're just going to tell you to treat the symptoms. Okay, so now diphtheroides are corny bacteria. They're normally found in the nose and the throat, sometimes the urinary tract and the skin. So they usually don't cause disease unless they have a phage in them. Okay, so then the phage will cause them to produce a toxin. So they're rods. They're kind of pleomorphic. They're not all the same shape. Okay, so humans are the only host. They're transmitted, they're airborne. Okay, so respiratory, like coughing. and it'll develop 2 to 4 days after exposure. Okay, so this is diphtheria. So diphtheria, hold on, we'll keep going. So diphtheria. Okay, so symptoms are fever, headache, body ache, sore throat, and then what it can do is it can form, because of the toxin, it'll form the pseudo membrane in the throat. Okay, so fibrin will build up in there, so it kind of forms like a wall or a membrane, and then it's got dead tissue and bacteria, and then the kids can't breathe. They don't have a good airway. Okay, so the other problem with this is that the sequelae can be really, really bad. Okay, so it can cause myocarditis, it can cause neurological problems, and then it can damage the kidneys and the liver and the adrenal glands. Okay, so in order to treat it, what they'll do is they'll use an antitoxin to counteract the toxin, and so that'll bind it. And then they'll also give antibiotics, and it's a combination of antibiotics together to get rid of it. Okay, the best way to take care of it is to prevent it. And to prevent it, they use vaccines. So they have the DTaP. And sometimes you have, like, maybe the letters are in a different order. So the vaccine is against diphtheria, toxoid, okay, tetanus, toxoid, and then Bordetella pertussis, which is whooping cough. Okay, so kids get it at 2 months, and then they get boosted. And then adults, we get boosted every 10 years, typically. Or like when you get hurt and they say, have you had a tetanus shot? So then when they give you the tetanus shot, they're boosting all of these. Ear anatomy. Okay, so external ears out here. So we'll talk about otitis externa. Middle ear is in here. Okay, so that's where we have, when someone has an ear infection, typically it's in the middle ear. Internal ear infections are not very common. Okay, so otitis externa is often known as swimmer's ear. Okay, so it's in that external ear canal. Lots of times, okay, it could be a couple different organisms. It could be staph, but lots of times it's Pseudomonas aeruginosa. And when you're swimming, and the Pseudomonas is actually pretty resistant to the chlorine in the pool, so water lays in your ear and then it gets infected. So it's actually hard to get rid of. Otitis media is the middle ear infection, and different organisms could cause it. Okay, so it could be strep pneumoniae, it could be strep pyogenes, and it could be Haemophilus influenza. Okay, so Haemophilus influenza is an organism that's part of our microbiome, but it can be an opportunistic pathogen. So it's named that because they were trying to figure out what was causing the flu or causing the influenza. They kept isolating that from people, but it turns out, flu's viral. So, okay, now a sequelae from having a middle ear infection in little kids could possibly be meningitis. Okay, so this picture is showing a normal eardrum. So if you look at it carefully in there, you can kind of see the ossicles, the bones of the inner ear. And then here's one with fluid in it, and it's harder to see the bones. And then here's acute, so it's all red and filled with pus. That's cloudy. Putting it in the eardrum, so you're putting it in the little tubes in here. So then the fluid will drain, because that fluid, if the fluid accumulates in there, it's a really wonderful place for the bacteria to grow. So if you can get the fluid out of there, then there's no growth. Okay, so symptoms: pain, fever, edema in the ear, the tympanic membrane, the eardrum starts to bulge, so earache. And then the treatment is usually penicillin, some sort of psyllin. If it's caused by strep pneumonia, the pneumonia vaccine can work for it, but they don't really give the pneumonia vaccine to kids. That's usually for elderly or people that have lung issues, like somebody maybe with cystic fibrosis. another treatment is to put tubes in the ear so that when you put the tubes in the ear, right, the bacteria. Okay, now viral upper respiratory diseases. So the common cold. So there's about 113 types of rhinovirus, okay? So rhinovirus is what causes a common cold. Okay, so get sneezing, runny nose, right? It can be transmitted by fomites, so if you touch something, so hand washing is really important to stop the spread of it. There's no vaccine for it just because it's kind of diverse what actually causes it. There's so many different types, and you just treat it over the counter. Okay, sinusitis. So sinusitis is when you have fluid in your sinus cavities in your skull, and you get an organism in there that starts to grow, and it can cause pressure and pain. So there's a lot of different organisms that could cause it, just because they're always present. So they are like opportunistic pathogens. Whoops, wait a minute. Shoot, what did I do? I think I had a sinus infection when I wrote this, so I was like writing all about it. Swelling of sinus cavities, right? So you get the pain and the pressure. So, and then treatment, it could be antibiotic. It can be a vasoconstrictor to reduce the swelling in the nasal passages so the sinuses can drain. Okay, now lower respiratory, so getting deeper into the lungs. Okay, so we have whooping cough is the first one. Okay, so whooping cough is caused by Bordetella pertussis, okay, which is a gram-negative coccobacilli. It can be found in adults, and it doesn't cause as many problems, but it causes problems in infants. Okay, so sometimes they call it a violent cough or a cough of 100 days. So little kids will cough and cough until they throw up, and then they're at risk for dehydration because they're throwing up all the time. Okay, so it usually doesn't invade the blood. It does produce endotoxin and exotoxin. It'll stick into the lungs. Okay, so there's 3 stages of pertussis of whooping cough. So the first one is catarrhal. So they have a fever, sneezing, they're coughing and coughing and coughing and throwing up. The paroxysmal stage starts after a week or so, and the mucus and the bacteria start building up in their lungs, and they're just coughing, and it sounds like an awful kind of whoop. You can Google it on YouTube and listen to kids coughing, but once you hear it, you know what it is. They can have, like, their oxygen can get low, so they look blue, so there's cyanosis. Okay, and then after that, after weeks and weeks of that, then you have the milder coughing for months where they convalesce. Okay, so to diagnose it, they'll hear that cough, and they kind of know, but they can also, what they'll do is they'll do a nose swab where they go way, way back in the nose to get it. And they'll treat with antitoxin and antibiotics. Okay, now they're going to try to prevent it. Okay, so they're going to prevent it with the vaccine. And there have been issues with the vaccine, but right now the one that they have is fine. Okay, so now pneumonia. Pneumonia is another lower respiratory disease, and it actually causes more death than any other infectious disease in the U.S. So elderly people are going to be at risk for it. Okay, so there's lobar that's going to settle in a lobe, and then there's bronchial. So the bronchial will be in the pathways, right? And then there's also pleurisy, and pleurisy is when it's in the pleura, right? So the membrane that lines the chest cavity is inflamed. Okay, now 95% of the lobar is caused by Streptococcus pneumoniae. Okay, so that's the big organism that causes it. but there's some other ones too, like Klebsiella. Okay, now you have to remember that pneumonia means that there's fluid in the lungs. Okay, so it could be caused by other things. There could be an environmental factor that's causing it too. So the symptoms that people have is they have a high fever and chills, and then they'll start coughing, and there'll be chest pain, and there could be blood in the sputum. The fever can be really, really high, and so they can see, right, the fluid in the lungs. Okay, so Streptococcus pneumonia, okay, is a diplococcus. Okay, it has a capsule. If it doesn't have a capsule, it's not pathogenic. This is the most dangerous one. Okay, so lots of times this is what's hard on the elderly. Okay, so it's going to go through. It can infiltrate the blood. They can go septic. They'll diagnose it with the culture. They can try to treat it with penicillin and Cipro. Okay, another organism that could cause pneumonia is Haemophilus influenza. Okay, so it's a coccobacillus. It's pleomorphic. It's found in your body. Okay, lots of times it causes problems in people that have other conditions. So they have COPD or emphysema, somebody that smokes. Okay, so that could be what's causing their pneumonia. Okay, then another one is Klebsiella pneumonia. Okay, so Klebsiella, see how sticky it is? It's got really, it causes lesions in the lungs. Okay, so the mortality rate is really high in old people. And they're going to treat it with cephalosporins. Okay, now another kind of pneumonia that's really different, okay, is Legionella pneumophila is the organism. Okay, so it is in water. Okay, so this is Legionnaire's disease. So Legionnaire's disease was named because it happened at an American Legion conference. So the men at the American Legion conference all came down with this certain kind of pneumonia, and they figured out it was from a hot tub. So the hot tub had this organism growing in it, and they all got it. Okay, so sometimes you hear about it in hotels, like you hear about it sometimes in Ocean City. Like there's always a little bit of it. It's not transmitted person to person, so you have to get it from a water source. Okay, so I have another picture of it. It can be treated with antibiotics. This kind of makes sense, right? So when you go to use a hot tub or swim in a pool, you want to make sure you can smell the chlorine or smell the bromine, because it's a warm place that organisms that like water can grow. Okay, now, a totally different kind of pneumonia is primary atypical pneumonia or walking pneumonia. Okay, so walking pneumonia is caused by Mycoplasma pneumoniae. Okay, so mycoplasmas are really, really, really small, and they grow really slow. Okay, and they don't have a cell wall. Okay, so they cause different symptoms than regular pneumonia. Okay, so people get a low-grade fever, they just feel bad, really tired, lethargic, and the alveoli, they get smaller, but no fluid builds up in them. Okay, so it happens in the winter and the early spring. So they call it walking pneumonia because people just kind of keep going with it until they get totally run down. Okay, so they can't culture it because it doesn't grow very well. So what they'll do is they'll look for antibodies, and they can treat it with the antibiotic. Okay, now another lovely lower respiratory disease is tuberculosis. Okay, so tuberculosis is caused by Mycobacterium tuberculosis. Okay, so it's an acid-fast bacillus. It requires oxygen. It grows really, really slow. Okay, so it can be transmitted through coughing, but it will also survive in dried sputum. Okay, so if somebody coughs on something and it's not cleaned up, it can still be alive there. Okay, so the symptoms are chronic cough. They just feel bad, low fever. Eventually people start losing weight, they have a bloody cough, and then the organisms start coming, they start coughing the organisms out. So here is a chest x-ray where you can start to see these tubercles. They get calcified lesions in their lungs, okay, and they start to build up. And then those will break apart, and then they'll start coughing out. So the organism is growing like crazy in there, right? And then they'll cough those out. Okay, so how the disease progresses. Okay, so there's infection. Okay, then the organism gets walled off so that you get those tubercles. And you can get tubercles in other places besides just the lungs. Okay, so you could get them in the liver and the spleen. Okay, and then the lesions can calcify, and then they break out. So it's pretty contagious. Okay, and the test that they do for it is a PPD test. Okay, so here is like the little lesions that can cause, and then there's a calcified lesion. Okay, so to diagnose it, they'll try to do an antibody stain of the sputum. They can try to culture it, right? And then they can do the PPD test. The treatment, because it's one of these acid fasts, it's harder to kill. And there's actually a lot of drug resistance to it because there's a lot of treatment failure. People don't, you have to take the drug, the antibiotics for so long, and people don't do it. So now there's a bunch of antibiotic resistance around. Okay, so what they suggest now is that you give them isoniazid and rifampicin, and it's a full year. But I think there's isoniazid resistance out there too. Okay, so the other things that I have on here are viral diseases. So I have flu, which we've talked about before. So flu is an orthomyxovirus. Okay, so there's 3 types, type A, type B, and type C. So A is found in birds and mammals. So when they talk about like the swine flu or the bird flu, okay, that's type A. Type B is only in humans. Okay, so A, they worry about it going from, like if it's in an animal, so if it's in an animal, so pretend it's in an animal, and then we have people, right? What they worry about is like recombination of the 2 different type A's to give us something that we haven't seen before. Okay, so flu symptoms, or flu-like symptoms, right? So fever, malaise, muscle soreness. They can have a cough, a sore throat, a fever. Okay, and then you start shedding the virus. Okay, usually the symptoms start appearing 36 to 48 hours after exposed. Droplets. Okay, so when school's in session and you can't get outside and they're turning on the heat, that's when we see more flu. Okay, so to diagnose it, they'll do throat swabs and some antibody tests. Okay, so there's vaccination is a way to try to treat it, to prevent it. So preventing it is what we have right now, and they try to predict what strain is going to be out there. There are some antivirals that they can try to give you to help, but they don't always work the best. Okay, now there are fungal respiratory diseases, but there's not as many of those as the bacterial and the viral ones. One is coccidiomycosis, which is also called San Joaquin Valley fever. It's in the dry areas of the Southwest, and it's found in the feces of animals. So this one usually self-resolves, but it could spread and cause meningitis. Okay, so the idea is if you're cleaning up, like if you're cleaning up a barn or a garage or something where there's lots of maybe mouse poop, that you're gonna make sure that you try to control the dust or maybe wear a mask so you don't inhale those spores.